4 flexibility assessments will be conducted. The standard sit and reach test is used to assess the flexibility in the hamstrings, and it is a suitable assessment for young and old individuals as well as pregnant women. The equipment needed for this test is a sit and reach box. To begin, have your subject warm up to prevent any injury. The hands should be one on top of the other with the middle fingers overlapping. In this test and all the other flexibility assessments, you should not be leading with one hand. Your subject must be barefooted and their feet must be completely against the box. Your subject will then bend at the hip, keeping their legs straight and exhaling as they're reaching forward. Their head can be tilted down. Hold the end position for 2 seconds. There should be no bouncing movements through this test. Allow your subject to perform 2 test trials and record the most distant point. The subject's best score was 10 inches or 26 centimeters. Given that the subject was a 25-year-old woman and her best score was 26 centimeters, the 0 point in most boxes is 26 centimeters. However, this box has a 0 point set at 23 centimeters. Therefore, from each value, 3 centimeters must be subtracted from the best recorded value to use this table. Given that the subject's best score was 26 centimeters and the box's 0 point is at 23 centimeters, we subtracted 3 inches, resulting in 23 centimeters. Using this table, we can categorize the subject's flexibility as needs improvement. The chair sit and reach test is used to assess the flexibility in the hamstrings in older adults who are 60 years or older. Allow your subject to perform 2 practice trials followed by 2 test trials. The equipment needed for this test are a chair that has a seat height of 17 inches that won't tip forward and a ruler that is 18 inches long. To begin, have your subject warm up to prevent any injury. After the warm-up, place the chair against the wall to stabilize it and have your subject sit at the edge of the seat. Have your subject extend the leg that is being tested, in this case the left leg, in front of the hip, placing the heel on the floor with the ankle dorsiflexed about 90 degrees and the knee extended the entire time. The opposite leg will be flexed and the sole of the foot will be flat on the floor about 6 to 12 inches to the side of the subject's body midline. One hand has to be on top of the other with the middle fingers overlapping. The back has to be straight and the head in neutral position the entire time. Have your subject bend at the hip slowly while exhaling at the same time and without bouncing, keeping it one fluid movement and holding at the end position for 2 seconds. Have your subject aim for the toe or as far as possible. Place the ruler parallel to the subject's leg. Measure the distance between the middle end of the big toe and the end of the middle finger. If the subject would have been able to touch his toe, the score would have been 0. If the subject would have been able to reach over the toe, the score would have been positive 2 inches, for example. The subject was not able to reach his toe or beyond the toe. From 2 trials, his best score was negative 1.5 inches. Perform the same procedures on the right leg 2 times and record the best score. On the right leg, he was able to obtain a positive score of 0.75 inches, which is rounded to the nearest half inch, making it 1 inch. The YMCA sit and reach test is used to assess the flexibility in the lower body that includes the hamstrings and the hip joint. This test is suitable for young and old individuals as well as pregnant women. The equipment needed will be a yardstick and a 12-inch piece of tape. To begin, have your subject warm up to prevent any injury. Place the piece of tape centered at the 15-inch mark of the yardstick. Then have your subject place their heels at the outer edge of the tape. With one hand above the other, middle fingers overlapping, have your subject slowly reach forward with both hands as far as possible, holding the end position for 2 seconds. When reaching forward, make sure that your subject is exhaling and that there is no bouncing. Also make sure that your subject's hands are in contact with the yardstick throughout the entire movement. For this test, your subject has to be barefooted. Your subject can tuck in their head through this test. Perform this test 2 times, and to keep score, the most distant point reached with the fingertip will be the score recorded. Here, the subject's best score was 13 inches. For this case, the subject was a 22-year-old male. Using this chart, we can determine that the subject's flexibility is well below average, and he is in the 20th percentile. The straight leg raise test is used to assess the flexibility of the hip extensors. These are the muscles that help tilt the pelvis posteriorly. To assess the flexibility, the equipment needed is a goniometer. To start, Have your subject first warm up to prevent any injury. After warming up, have your subject lie in a supine position with their lower back close against the floor, head against the floor, and arms to their side if wanted. Then lift the subject's leg while making sure the other is flat on the floor. Assist them if needed. Then place the axis of the goniometer on the greater trochanter. As you are pushing the leg up, make sure your subject's knee is extended and that they are not in pain. You also want to assist in raising the leg to obtain greater results. Make sure your subject is exhaling as the leg is being raised. An angle between 80 and 90 degrees is considered acceptable, as well as anything above 90 degrees. Anything below 80 degrees will be recorded as unacceptable. In this case, this subject's angle of flexibility for the right leg was 86 degrees, which is acceptable. The same procedures will be conducted on the other leg. The angle of flexibility for the left leg was 85 degrees, which is also acceptable.